Join me Monday through Friday at 8 a.m. as I count down the top 10 Texas Red Dirt songs that are packing the dance floor. I'll be featuring local artists and the story behind the hits, shows in the area, as well as new songs that make you want to dance. It's Dance Time in Texas with DJ Mike on Lone Star Community Radio, 104.5 KCZW and 106.1 KZCC, Conroe, Texas, or online, irlonestar.com.
Thank you for listening to Lone Star Community Radio. This program was broadcasted and recorded live from the LSCR studios in downtown Conroe, Texas. Lone Star Community Radio is supported by listeners like you. Donate and sponsor today. For more information on getting involved with Lone Star Community Radio, contact us at lscrstudios@gmail.com or visit us online at www.irlonestar.com.
That's right. You are listening to Mornings of Lone Star here on Lone Star Community Radio, worldwide at irlonestar.com, and Conroe's FM 104.5, 106.1, and now currently broadcasting on YouTube and Facebook Live because I have a special guest today. He's actually been in the studio before, and I saw a post about him not too long ago about how he got a promotion, and I wasn't even invited to the party for the big promotion. We have Dr. Casey Patrick, who's now the medical director over at the Montgomery County Hospital District. I hope I got all that right, Doctor. Dr. Casey Patrick's in the studio. What's going on, man?
Yeah, thanks for having me again. I missed the party myself.
Oh, you did?
Yeah.
They made you start working day one, huh?
No candles and cupcakes yet. I think I have to earn those.
Oh, okay. Well, if people don't really know what's going on, I put some links for the Montgomery County Hospital District. They're the local. I guess I wouldn't call it a local. I don't really know. It's
County EMS 911 service provider.
That's the best way to put it. So when you dial 911, that's who you're talking to.
In Montgomery County, you'll get a Montgomery County Hospital District EMS truck. Now, Montgomery County Hospital District, my focus is the EMS service. There is several other pieces to the hospital district in our county. We have indigent care through our HCAPS program.
Mm-hmm.
We have community health and community paramedicine, public health, and community paramedicine. And then all the other pieces that support our EMS mission, the fleet department, radio department, accounting, billing, the administration side, facilities that keep everything up and running. So it is much more than just an EMS service, but as the medical director, my primary role was interacting with the paramedics who will be on the red and blue decaled trucks that show up in your driveway in Montgomery County if you call 911.
You're kind of the overseer now. On the back end, you're making sure everyone is doing their job, and you're also updating everybody. Because I imagine information has to flow down.
Yeah, I mean, it's what an EMS medical director does is very service and location dependent, and different EMS medical directors have different answers to that question.
Yeah.
For us, I mean, when we talk about what I oversee and what our team oversees, it is the clinical care, the medical care that the paramedics, the EMTs, the AMTs in the county provide. And it's a huge county and a large system with 300 plus clinicians providing care in the county. So reaching them within that 1,100 square mile radius is not an easy task. And we also have 13 first responder organizations or fire departments for the most part under our medical direction as well. So there's literally thousands of folks out there doing CPR, providing epinephrine for anaphylactic shock, defibrillating cardiac arrhythmias every single day. And so reviewing those charts, making sure things are running smoothly and properly, providing education for the weak spots, introducing new protocols and new medicine into the county. Yeah, I guess in the end, that's my primary role.
I feel lucky to have you here this morning because it sounds like you're very busy.
It's good busy. I enjoy it. Couldn't be.
Well, you were a paramedic yourself, weren't you?
No, I was not a paramedic. That's probably a significant hole in my resume in this world. I went to medical school at the University of Kentucky, did my emergency medicine residency training at Indiana University in Indianapolis, and I've been here in Conroe since 2009. practicing as an emergency physician. So,
Oh, okay.
so
Because I remember you've been here for a while.
Yep, I've been here for almost 15 years. I've been in several of the county emergency departments. Hopefully, none of your listeners have had to see us because generally it's not a great
Yeah.
day.
Well, no, we were just talking about that off the air. Was when you're working as an EMS driver, it's never like the person who you're riding with, the person who has to ride with you is not usually having the greatest day.
No, I was.
So
It was several years into the job where I realized no one ever wants to come see me. It's a bad day. And once you swallow that and digest it a little bit, it makes it easier to understand sometimes when people are less than happy to see me. But in the end, my training is in emergency medicine.
you're numb to it all. So it's like, Mom, I don't care. You're like,
Numb.
no, I'm just kidding.
I hope not.
No, I didn't mean it like that. I'm just saying it's just the idea behind it. Because one thing I want to understand is the Montgomery County Hospital District, hypothetically, say it was erased tomorrow. Is the infrastructure, because y'all provide the infrastructure for all the medical transportation stuff for the county, pretty much, like I would say a high percentage of it, right?
All 911
So, I mean,
EMS transports in the county.
so yeah,
because
because I was thinking about this, because you guys have been around for like, what, over 30 years?
Yeah, there's been some
Name changes and stuff.
changes, and there was
But I would sorry to interrupt. I'm just trying to think. It's like, so if y'all didn't exist, what would the current situation be for all these hospitals? Like basically the 911 would be handled by Houston.
No, I mean there's various ways that you can structure EMS in this
Yeah.
country. You can, for instance, in the Northeast, a lot of the Northeast states, EMS is run through the hospitals themselves. Very, very common.
Interesting.
Very common setup in Houston, for example. Cy-Fair, EMS and fire are combined, so EMS is under the fire department's umbrella.
Okay. See, this is what I love to understand, because you look at how great a service is and you try to mimic that somewhere else. And like Montgomery County Hospital District has been working pretty hard all over the place, because I remember when COVID was going on, we were getting updates primarily through them. Mm-hmm. And I thought that was really strange. And I was like, but not in a bad way, but it was like, these guys are just doing everything, aren't they? Like,
Well, that's the public health portion of our organization, and they do an excellent job. Honestly, I'm sure you could move the pieces and change it, but we have a very, very solid foundation. We have decades of experience, and there are a lot of folks within the organization who have literally been at MCHD for decades.
Yeah, well, it's dedicated to Montgomery. I think that's the neatest thing about it, is that's who they're putting first, is the Montgomery County Hospital District.
So we have an elected board, and the elected board are the ones that provide financial and budgetary oversight. So if we want a new truck, or if we want new stretchers, or we want new ventilators, that all has to clear through our elected officials.
It's funny. I was thinking about this because when I knew you were coming in, I saw the new mail cars, the new electronic ones you were talking about, the mail trucks. And I was thinking to myself, I was like, I wonder what would happen if somebody updated an EMS unit, like top of the line, all the new toys and technology, how crazy that would be compared to like 30 years ago.
I would argue that our trucks our trucks from a technologic standpoint are futuristic relative to 20
because
years
I've never
ago.
been in one, and fortunately I've never been in one. But I was thinking, because those mail trucks have been around. I mean, every time you see them, you're like, I bet that truck's at least 20 years old. And I'm sitting there thinking, not saying the medical ones are going to be old, but it's just the technology that they have today, and how you can do readings and all that kind of stuff. It's got to be wild.
Yeah, I mean, we can track our trucks. Our trucks have driver safety cams. They alert when you reach certain speeds, when you reach certain turn forces. Well, not counting all the medical equipment that's on there.
I bet what you can't wait for is all the electronic cars going to be on the roads, and then when you turn on your lights, it sends a message to all the e-vehicles, and they have to pull over automatically. You have no control over it, and like the EMS unit can just go.
If you are listening out there, and
that doesn't happen,
and you see us behind you, please do your best, or in front of you, do your best to pull over, safe for everyone involved.
Yeah,
for sure.
No, I mean, I always love it on certain roads out here, because I will say some of the roads are curvy, and you're like, you have no idea what's going on, and then you actually don't even hear it before you see it a lot of the times. I feel like that with me. But, everyone's pulling over. Everyone seems to be doing okay. I don't think there's ever... What's the worst road here in Montgomery County? I guess 45.
Yeah, I mean,
no one knows what's
45
going
from just high speeds, but
Yeah.
there are several. In the end, we are very proactive with trying to minimize the use of lights and sirens and high speed driving to only utilize that procedure. We treat it as a procedure.
Yeah, I remember us talking about this.
Yeah, we try to make sure that we only use it when it is a time-sensitive situation for the patient. Otherwise, it puts the patient and the public and the paramedics at greater risk without benefit, and there's very compelling and strong data to support that. 20 years ago, we did run lights and sirens in the terminology that we use inside the building, run hot, fast, whatever you want to call it, to all calls. And we realized that not all calls warrant that. It doesn't mean that call is not urgent. It just means that we want to balance the risk with the benefit and look at literature and data and try to support that.
He's calling us all horrible drivers is what he's calling us. And I agree. We're all terrible drivers here in Texas because we want to do our own thing. I'm just kidding.
No way.
I'm kidding.
No way.
I'm kidding. No, I think that's I remember you telling me that. I was really shocked because it made total sense to me. And then especially with the way y'all train your EMS units to really comprehend, I would say realistically 2 days of data all in 2 minutes in a minute, because you're on a phone call. You're probably dealing with somebody who doesn't know how to explain it to you in the way it's best. And then you're trying to gather all this information before you get to point A. And when you get to point A, you have to assess. And then you're like, all right, let's get back to point B. How are we going to do this? And
I mean, it starts with our dispatch center, which our dispatch center is accredited out the wazoo. They are really the first point of contact for everyone in the county from a medical standpoint, and they're making just split-second, very complex decisions with a phone conversation, and oftentimes a phone conversation with a caller who is distraught, rightfully so. They are trauma adjacent, cardiac arrest adjacent, their family member, their loved one's sick and struggling, and then we're going to ask them questions and try to work our way down a very detailed, specific flow sheet to send the right truck from the right place with the right crew at the right rate of speed. Their job is exceedingly difficult because, like you said, they're on the very front end of the patient pathway, and they have limited information. They don't even have eyes on the patient.
Well, I want to say y'all have a program, like a 911 program that you can sign up for as like a citizen. Like I can sign up and y'all have certain information on me.
We offer lots of community.
I forgot what it was though. I'll try to find it because I remember it was something where you could sign up and it's something with your phone and with your contact. It's all this kind of cool tech stuff. So it's unique to Montgomery County Hospital District. So when you do get a call, unfortunately, like they have some, I'll look it up. I'll find out.
Yeah, I mean we have lots of ways that you can become more involved with what we do. Stop the bleed, CPR, safe sitter, lots of programs where we can help the public be more medically inclined and medically knowledgeable.
I'll find it. But one thing I got to ask, because you did get a promotion, what's the big goal this year then? Because this is relatively new. I want to say you got announced like last month or something like that.
Yeah, I guess I'd probably be remiss if I didn't thank my predecessor, Dr. Rob Dixon. Really mentor and
he retired, correct?
Friend, retired. EMS leader, emergency physician, expert, clinician. Just very lucky to have gotten to be his assistant for almost 10 years and really learn the ropes. 100%. I would not be in this chair talking to you if it weren't for him. But yeah, for the next year, I want to find my footing and figure out how I best fit in the organization. We have some equipment changes looming on the horizon that will probably be the big focus for me clinically this year.
Is that something when equipment has to be changed? Is that something that comes from the state, or is that something or is it just kind of like, hey, the best practice this year, this new thing came out, so it's the best way to?
Not the state necessarily. Sometimes it can be we need to advance because of evidence informed advances, i.e. there's a new product that's better. We are replacing our ventilators in the first quarter, so that's coming up next month. Our ventilators are at the end of life from a product maintenance standpoint.
Okay.
So that's just a necessary replacement. We're going with a more robust, hopefully solid. These things, you can throw them from the top of the skyscraper.
That's intense.
They were built and designed for the military in Desert Storm in Iraq and Afghanistan, and so I believe they will withstand Montgomery County. We'll see. We're very pleased with their capabilities. They'll be on every truck, so if you need respiratory support in Montgomery County, you'll get it with new ventilators starting here pretty soon. And then our primary airway maintenance, our airway management device you see on movies and TV shows. When they place into tracheal tubes, you use a tool called a laryngoscope. That's the blade that snakes down the tongue and into the posterior airway, and we place tubes through the vocal cords into tracheal tubes. We use video laryngoscopy here in Montgomery County. We have for well over a decade. We were definitely on the front end of that technology. Big thanks and props to past medical directors. Dr. Mark Escott was involved in that decision, and that was very, very beneficial for our patients. But at 10 to 12 years, those devices are ending.
They've been in enough throats.
They're ending their lifespan as well. So we hopefully will be able to look at new recording video laryngoscopes. We'll add some technology there. The idea that recording piece is important to me as an educator. So now not only will we use a video camera to place the scopes on the truck, on scene, on the side of 45, myself and the quality team will have the ability to pull those video clips, watch them, and provide education and feedback to the paramedics after the call. Our current scopes did not record. That was not technology that existed in 2012, 2013.
A storage issue. It's always a storage issue.
Yeah, and this will be definitely a storage issue from a HIPAA-protected standpoint. We'll have to make sure that we dot those I's and cross those T's. But it will really add an educational feedback plus for the service, because not only will you manage that patient real time, but after the chaos settles, 3 days, 4 days, a week later, we'll be able to review all those calls and provide both mechanical and procedural feedback. Also, what you see in real time in chaos versus what you see from the comfort of a chair like this, oftentimes, I know from my own practice, can vary, and it will be a really excellent tool for us to get even better than we are now at managing those difficult airways.
Yeah, because I know here at the station, we actually had an incident where I believe the man had a brain aneurysm, I want to say, because we were recording a show and there's a lot of people in the studio, and I started hearing slurred speech, and I was like, and I peek around the corner and I look at him, and I was like, oh, that guy's going to pass out. And he did. And then the doctor, I got a phone call, like, hey, do you have footage of it? And I'm like, actually, I do. I actually have a camera right on him, and you can literally see it go from here, like he's doing fine, and then he starts stumbling, boom, done. So I sent that to him, and apparently it helped out because, like you said, it's all about educating and things like that. I think that's kind of cool. Especially one thing I like what y'all do is y'all have your own podcast, and it's more focused on the EMS drivers and basically everyone involved in the whole Montgomery County Hospital District, the way you do your episodes. But it's free to the public, meaning like you can go on YouTube and go to the Montgomery County Hospital District YouTube, and you can check out your show. You're the one that hosts it.
Yes.
So, and you kind of I think y'all do like one a month usually.
We're at one a month now. We've been working on the podcast now for over 4 years. We're headed on our fifth birthday, coming here pretty soon. We really came up with the idea just due to the fact that it's a huge county, and we have literally thousands of providers out there every day. And as much as I would love to sit down in small groups individually with each of them, there's one of me and 1,500 plus of them. So yes, we have mandatory education programs every quarter. So I do see all of our MCHD medics, EMTs, AMTs every quarter, and that's very, very important to me to get to see them so you can try to build that personal relationship as a teacher. But it's not enough. And so how do we spread our clinical message? How do we provide spaced repetition from an educational standpoint on new protocols, new initiatives, areas where we need to shore some things up? And the podcast really grew out of that problem.
Yeah, it was
and
neat. Because when I listened to it, I was like, this isn't for me. He's talking about something specific here. But then it was more educational than anything because it's like, oh, this is that world. I've never been in that world before.
And we try to make it nice and compact. Everybody's got a 20 to 30 minute commute here in Montgomery County, so we try to keep that 20 to 30 minute range, and we really try to make it no fluff. We don't do a lot of banter or chitter chatter. We keep it pretty clinically oriented. So it is emergency medical podcast for our providers. We found some definite advantages and pluses that we didn't expect early on. We've had tons of success and positive feedback in recruiting, which in EMS today, post-COVID, this wasn't a problem that we anticipated when we started this 5 years ago, but the paramedic workforce took a pretty decent beating, like a lot of healthcare did over the pandemic. And so now for us to have this as an avenue to outreach without trying to outreach to medics who are looking for jobs that are coming out of paramedic school, that may be relocating from the East Coast, the West Coast, the Midwest. Every new employee onboarding session that we have, and I speak to all the new employees before they start, we usually do a quick poll, who's a podcast listener, and the hands fly up. And so that's something that we didn't expect. It's been a real plus for the service and for the people of Montgomery County. It's helped us maintain our recruiting and maintain our staffing on the trucks, at least in some small way. So we're proud of that. And it's just a way to talk medicine with the medics without having to sit in front of them and doing it in an asynchronous way that they can access easily on their drive. So we're proud of it.
No, I think that's something, and I'm kind of amazed at everything you do personally, because now I'm learning, especially with your new position, because you're, if people don't know who I'm talking to Dr. Casey Patrick. He's the new medical director at the Montgomery County Hospital District. And you're kind of overseeing pretty much, it sounds like, or your hands are in kind of all aspects of what's going on in the field. Because I can't even think about going to a truck and looking at every piece of equipment and then doing the research about what new trucks are doing, and then not even start new procedurals with human beings. So now, because you have the truck and then you have the human being in the truck, and then you have the process that both of them combined try to give the best service to the patient. And that can be, I mean, that's could be like a one-person job all year just researching that.
Well, thankfully, I've got an amazing team. There very little happens in the organization with, my decisions solely. Most everything.
You're not the dictator yet?
No.
Oh, that's director. Oh, I thought it was medical dictator.
No dictator. Nor do I want to be, because honestly, like we said before, I'm not a paramedic. I'm an emergency physician. So I tell our medics.
What's the difference in that? Help me out with that.
Well, paramedic training is, they don't go to med school. They don't go to residency. It's a separate training pathway.
But I would see you at the hospital.
You would see me at the hospital, not in the ambulance.
Okay. So that makes now I understand. I'm talking about where are the bodies.
Yep. So I'm in the emergency department, and so while we do a lot of very similar things clinically, when it comes to how the patient and the truck interacts, for example, how the dispatch center dispatches the trucks, how we order the trucks, how the supplies are placed on the trucks.
Yeah.
Those things are really well outside of my wheelhouse, and so we have lots of other folks in the organization that handle those pieces. When they overlap with the medical side, the wonderful part about my job and about our team is that we are very much a team, and there is lots of cross-department information flow. And so if it's something that does tread into the medical realm, I'm always involved, and it's a really excellent spot to be as a medical director. I also have a team of clinical folks that I work with that are just amazing at the jobs that they do. We have folks that review all of our high-risk charts and bring those to us weekly. I
guess we could just ask the hospitals how y'all are doing.
We can and we do.
Because that's where you're kind of going, right? When you pick someone up, you're going to one of there's so many hospitals now in this area.
We value our hospital relationships greatly here in Montgomery County. We've worked a lot longer than I've been at MCHD to be a partner with them, because really in the continuity of patient care, we're the front end and the hospitals, take over from us. And so we spend a lot of time in collaborative meetings, collaborative projects with all of our hospital partners to make sure that we're communicating
that's what I mean.
Our needs, our patients' needs, and that they have the chance to give us feedback on the back end. I get a lot of great job phone calls from our hospital partners. I do get a fair number of, hey, can you take a look at this one? Phone calls from our hospital partners. And if we didn't have those relationships, those contacts and those phone calls wouldn't really be as easy. And in some communities, in some situations, there's an adversarial relationship between the hospitals and EMS. Not the case here in Montgomery County. We're cooperative and we work together.
And I think that's really important. I think the Montgomery County Hospital District chose a good medical director in you, because one thing I've known you for a little while, and one thing I love about you is your ability to want to learn. And it's not like from a high-end perspective or low. It's like we need to learn, because that's how we improve this field. And
it's hard, and no one's going to bat 1,000 in this job.
Yeah.
And in a complex call, if you're on scene for 20 minutes and you have a 20-minute transport time, the medic may have 40 minutes with that patient and literally make hundreds of decisions.
Yeah.
So we really try to start from that foundation. None of us are perfect. We get up in the morning, we want to come take the best care of the community as possible. If we start there and we put our patients first and we put our time in with the protocols and we know our protocols and we know our truck, then we've got a starting foundation. Are we going to be perfect from that point forward? No way. But if we don't look at our system from an oversight standpoint, then we can't guide the system properly as far as protocols and how the truck's set up. And then the individual medics fall in that same bucket. If we don't watch and follow our high-risk charts, then we don't find weak points that the medics have, or weak points that we may have in that we didn't educate it well to start with. So we do get feedback from the hospitals as far as our performance goes, but part of monitoring our performance is our own job to monitor that as well. And we take
that's what I'm saying. You're doing that. Like,
we take it seriously.
It's kind of like working for you sounds really tiresome.
No way.
I'm just kidding.
Somebody out there may be rolling their eyes and like, he emails me at 8:00 at night.
I believe it. I totally believe it. Now, I want to thank you for coming in. Is there anything else you want to cover? Because I know you got a lot going on, and I'll put a link to the YouTube channel for the Montgomery County Hospital District. And then congratulations once again for the new medical director position. And
I guess I have to plug the podcast, MCHD Paramedic Podcast.
Yeah.
If you'd like to learn more about us and what we do, it's a good place to start. That's number one. Number two, I just can't thank the organization, the administrative crew, the executive staff for putting their trust in me to do this job. I'm lucky. I'm thankful. And we're going to work as hard as we can to continue providing the highest quality EMS care for our patients at the county. And anybody out there who has any questions, comments, my door is open. I feel like I work for the organization, I work for the medics, work for the community, and that's a pretty cool spot to be in.
All right, guys, if just now tuning in, Dr. Casey Patrick, the new medical director for the Montgomery County Hospital District. You're listening to Mornings of Lone Star here on Lone Star Community Radio. I know we were supposed to have Son from Dragon Ball C in. Unfortunately, he had to cancel, but he's going to be back. Don't worry. But you've been listening to Mornings of Lone Star here on Lone Star Community Radio, irlonestar.com worldwide, and Conroe's FM 104.5, 106.1. I'm out. So I think what the next live show is going to be the Cindy Cochran Show. That'll be later today. So stick around for more community radio on Lone Star Community Radio.
Lone Star Community Radio is looking for those who are interested in hosting their own talk show. With monthly and weekly slots available on Conroe's FM 104.5, 106.1, and on irlonestar.com. Start your own podcast.